for Senator Skolfeld.
Thank you, Madam Speaker. And I want to thank my honourable colleague for Courtenay-Alberni for bringing attention back to the critical public health emergency of the opioid crisis. He mentioned the extraordinary work and the courage of Moms Stop the Harm. Leslie McBain lost her son. She is one of my constituents from Pender Island, and it reaches every community. And it is not so much overdoses as fentanyl poisonings that are occurring. And it is urgent. And I just wanted to thank him for raising it and join in his hope that we will see a real movement in the upcoming budget to address the opioid crisis if he wants to comment further on what needs to be done.
Honourable member for Courtenay-Alberni.
Thank you, Madam Speaker. And I want to thank my colleague for raising this very important issue, because everyone across this country is being impacted by the opioid crisis, and it's preventable. These are fentanyl poisoned drugs that people are using right now when they need a clean source. She asked about some of the solutions. Well, we need therapeutic treatment centers like Portugal. We need the government to actually declare it a national public health emergency, and to build affordable housing so that we can get people in stable housing and get them the wraparound supports that they desperately need. It's the only way we're going to resolve this issue, Madam Speaker. And I appreciate the pilot project in Vancouver and Victoria that is happening right now, but they need to broaden that right across the country. Rural communities like where I live in Port Alberni, I've seen like 3 of my friends' kids die in the last 6 months. Not seen them, but I've known them, and these are lives that are lost, that are all preventable deaths that could have been done with common sense policy. Instead, the government is right now playing politics that's costing people lives, and it's unnecessary. They need to take urgent action. They need to listen to Mothers Stop the Harm. They talk about listening to public health emergency and medical experts. Why aren't they doing that right now when it comes to the opioid crisis?
Resuming debate.